Hi, everyone. My name is Genny Castillo, and I'm the Regional Engagement Director for the Southern Economic Advancement Project, also known as SEAP. In a partnership with Fair Count, we are excited to announce our first house call for our hashtag Count Me In series, where we will feature doctors, nurses, scientists, and other leaders who will speak on the current state of COVID-19 viruses and the vaccines. In addition to these events, we will have organizers and volunteers reaching out to Georgians to ensure that they're informed of their vaccine options and connect them with the appropriate vaccine provider. For tonight, we are excited to introduce our special guest, Dr. Carlos Del Rio of Emory University. Dr. Del Rio, we're so happy to have you here. We would like to start.
I'm delighted to be with you.
We would like to start with you telling us a little bit about yourself. What do you do, and how has the COVID-19 virus and vaccine impacted your work?
Well, Genny, thanks for having me. I'm a physician. I'm an infectious disease physician. I have been in practice. I finished my infectious disease fellowship in 1988. So I've been in practice since then. All my life has been dedicated to infectious disease, but more specifically to HIV. And I've done a lot of my work and a lot of my research and a lot of my contributions have been around the HIV epidemic. And when COVID started, obviously, then I started looking at COVID. And to me, a lot of the things that have been very important in my work is that, we know the HIV epidemic is an epidemic that disproportionately impacts people of color, minorities, disenfranchised population. And when I saw that it was the same population impacted by COVID, it really hit me like, you have two different pandemics, but the people suffering are exactly the same. The most affected populations are the same. And therefore, I felt like I had to get involved. I had to do something about this. And I've been doing several things from, taking care of patients to doing research to being in the media, to talking to people, to, speaking to politicians, to trying to change policies, to really try to end this pandemic. Specifically around the vaccines, I am the part of the Emory Vaccine and Treatment Evaluation Unit. And we've been very involved in some of the vaccine studies, primarily the Moderna vaccine study and now the Novavax vaccine study. And we put a site here at Grady Hospital, and where I have my clinical research, and Dr. Colleen Kelly, who works with me as the principal investigator in the studies. And our goal was to ensure that there was adequate representation of minorities in our clinical trials, because we wanted to be sure that if the most affected population were Black and brown people were included into the study. And we're in a mission to do that, and that's what we've been doing.
Thank you so much, Dr. Del Rio. As your experience in studying these vaccines, talking about them every day, what are the differences between the Pfizer, Moderna, and Johnson & Johnson vaccines?
Well, let's put it this way. They're different in the sense that the technology is different. The Pfizer and the Moderna vaccine use a technology called the mRNA technology. And the way I explain it to people is it takes, when we found out that in this new virus, there was a protein called the spike protein, and that the spike protein was the key to immunity, that if you develop antibodies, people that recover develop antibodies against the spike protein. So that spike protein was then, the idea is to deliver that to your body, so your body develops antibodies against the virus, which is a vaccine, what a vaccine does, without giving you the whole virus, just giving you that little piece of protein. And there's two ways to do it. One way is to put it inside a cassette, which is the mRNA, right? To take that little cassette that then takes that protein, that encodes the generic material for that protein into your cells. So your cells then produce that protein and show it to the immune system. The second way to do it is to put that piece of genetic material inside a cold virus, an inactivated cold virus, which is called an adenovirus. And that's what the Johnson & Johnson, the Janssen vaccine does, and also the AstraZeneca vaccine. And the third way is to take a little piece of the protein itself and give it as a protein vaccine, and that's what the Novavax vaccine is. So they all use different technologies to achieve the same end, which is to get that spike protein to stimulate your immune system so you produce antibodies against it.
Interesting. So with that and trying to understand these proteins, does the vaccine actually give me COVID-19, and will it protect me from new strands?
So it's interesting. It does not give you COVID vaccine and COVID disease, because you don't get the COVID virus. You get a little bitty piece of the virus. You get just that spike protein RNA, or that spike protein in a vector. But what it does is when your immune system sees that protein and starts responding to it, for a day or two, you're going to feel not very good. You may feel pain at the site of injection. You may feel fatigue. You may feel like, you had a fever even. But that's just because your immune system is reacting to that piece of protein. It's actually responding. It's doing what it's supposed to do. After that, you're going to feel totally fine. But no, you don't get COVID from getting the vaccine. And the side effects that people describe, what we call in vaccine world reactogenicity, is because your immune system is waking up as a result of the vaccine.
That's really good to know. We've had a lot of people share some questions to us. How do we know the long-term effects of this vaccine since it is so new?
Well, first of all, let's start by asking about the strains, the different variants. The available vaccine work against the most common variants we're seeing in this country. There's a variant from South Africa that the vaccines don't work as well, but they still protect you. They don't protect you from infection, but they still protect you from severe disease and from death. And, having somebody that prevents you from dying, it sounds like a pretty good deal to me.
Hello. Certainly.
The side effects, most of the side effects in vaccines occur early. In other words, when we did the clinical trials, as an investigator, I can tell you, the company's major focus may be efficacy. Does this work or not? That's what gets a lot of press. As an investigator, my major focus is safety, is tolerability, is making sure that we're giving a safe vaccine, because vaccines are given to healthy people. You don't want to give somebody to someone that is going to make him sick. So safety and tolerability are a major focus of clinical trials. And I can tell you these vaccines are very safe.
Thank you for that. I know, too, one of the things that we've talked about with some of the folks that are nervous about this is it happened so quickly. So how did this vaccine and the other vaccines get approved so quickly? And have there been other vaccines or medical advances approved this quickly in the past?
Well, let's put it this way. It wasn't like we started from zero. Back in 2002, 2003, we had a SARS epidemic. And after that SARS epidemic, and some people may remember, some people don't, SARS epidemic led to the development of vaccines against SARS and looking for ways to develop vaccines against SARS. In addition to that, the NIH has something called the Vaccine Research Center. And even though the Vaccine Research Center was put there to focus on vaccines for HIV, the scientists there started developing vaccines for other diseases like Zika, like Ebola, like many other epidemics that have happened. And then this technique of mRNA was developed for those diseases, for Ebola, for Zika. And in fact, a lot of the research around this new technology was done by a just fantastic African-American scientist, a PhD scientist called Kasmika Corbett. And Kissy Corbett, who is an amazing PhD scientist, African-American woman, is a lot of the brains behind this mRNA technology was under her watch. She made this happen. So when we had the spike protein, we had the virus, genetic identification, and we had this technology, they were brought together, and then we started doing the clinical research. So we didn't start from zero. That was one thing. Number two, no corners were cut. What was cut was red tape. What was cut was unnecessary steps. We used to do phase 1 and then phase 2 and then phase 3. Here, phase 1 and 2 were kind of done together. And then the most important thing that happened, I think, of all the things that the administration didn't do right, one thing that they did right is they went to companies, and when they started doing the clinical trials, the phase 3 studies, they said, we will pay you money to start producing millions of doses of your vaccine. If at the end of the clinical trial, your vaccines work, we have vaccines, we release them. If at the end of the clinical trial, your vaccines don't work, we'll throw them away. So the risk was financial, but there was no other risk. The risk was financial. And what that did is that then we didn't have to wait for the clinical trial to be completed to start producing the vaccines. We would still be waiting for vaccines to be produced if that had been the case. So we started having vaccines because we started producing them early on. And that, I think, was a very smart move. So that's what made it happen so quickly. A lot of those things went into place. No other time have we started producing a medication at the time that, with the idea that, well, if it works, we'll have it there by the time we need it. And the reason this was done is because we had this horrible pandemic. Thousands of people were dying. Millions of people were dying globally. We needed to be quick. So was it done quickly? Yes. Was it done correctly? Absolutely. Were corners caught? No.
Awesome. Thank you for that, Dr. Del Rio, because I feel like a lot of people are very concerned. Like all of a sudden, everybody thinks that they have their own PhD, and so they're kind of fighting against each other. So hearing that is very helpful. Now, we still do have some people that may be hesitant to get the vaccine. What would you say to those that are still hesitant to get vaccinated?
I would say several things. Number one is get the vaccine. It's how we're going to get out of this pandemic. Number two, I took the vaccine. I took it like the first weekend it was available. My healthcare system made it available. Emory made it available. My employer. I went that Saturday to get the vaccine, and the most important side effect I had was this overwhelming sense of gratitude and of also overwhelming sense of happiness, because I said, I'm seeing patients all the time. I'm getting exposed all the time. This is going to protect me from getting infected. The other thing I would say is I took it. I have recommended to my family and to my relatives. I would not give anything to them if it may produce damage. So I'm telling you, take it because this is the right thing. Number three, we all want to get together again. We want to get together with our families. We want to get together with our friends. We want to go out for dinner. We want to have guests over for dinner. The sooner we get people vaccinated, the sooner you're going to be able to do that. CDC has said to us, fully vaccinated individuals can now gather, congregate in an indoor setting without their mask on. The other day I had some friends over to my house who are fully vaccinated for dinner. It was amazing. It was surreal. I hadn't seen anybody like that in a long time. We need human contact. We need to get together. We need this pandemic to end. And the road to ending this pandemic is the vaccine. So get your questions answered, get your information, but also get a vaccine.
Thank you so much, Dr. Del Rio, for your time, for your knowledge, for your wisdom, and for your support. We definitely are looking forward to making sure that all Georgians are vaccinated. And on behalf of SEAP and Fair Count, we thank you for joining us tonight. To those watching, be sure to check out our website, countmeinga.org, to learn more about the vaccine and find a provider near you. We hope that you take care, stay safe, and we see you soon. Thank you so much.